Dr. James Haley, and I'm just going to talk a few minutes about pelvic prolapse. Someone who does a lot of urogynecology and pelvic reconstructive surgery, in evaluating patients, a lot of the same questions tend to come up, and one of the most common questions is about stages or degrees of prolapse. What does that mean? If I have a problem, what is my stage? It can be a little bit confusing because there's actually two different systems of how to grade this or stage it, and there's a lot of similarities but a little bit differences, and that can add to the confusion. So pretty simply we can grade a amount of prolapse as first degree, second degree, third degree, or we can use an actual staging system of stages 1 through 4. Basically, with a stage 4, a woman has essentially complete prolapse. Everything is hanging out completely. Thankfully, we don't see that often, but certainly that can happen. So basically, instead of dealing with that, we're really talking about 3 stages or 3 degrees. And so a first degree or first stage is just some mild loss of support. It's not significant. It's not approaching the opening of the vagina. And so typically not a lot needs to be done. Sometimes if women are starting to have some symptoms of pressure or leaking of urine, types of pelvic physical therapy, Kegels, and so forth can help, and then potentially avoid surgery. But when someone has a second or third degree prolapse, or stage 2 to 3, well, now with stage 2, the protruding organs are approaching the outside of the vagina. They're not quite there yet. And then you can think of a stage 3 as now the prolapsing organ is coming outside of the vagina. So pretty easy way to think about it. Stage 2 just up inside, stage 3 maybe starting to protrude out. And generally, not always, but generally when a woman gets to stage 2 and on is when surgical correction is going to be required. So I hope that clears up some of the confusion. As always, if you are having an issue or questions and would like to come in to be further evaluated, I'd be very happy to see you. And thank you.